A very good afternoon and warm welcome to all our viewers. My name is Dipali Safaya and I welcome you all to We Talk Do You show, a show by Puberty to Menopause, a public health awareness initiative by Human Biological Institute. Puberty to Menopause is yet another platform created by Human Biological Institute where we try to provide expert medical advice and create awareness on women health. It's my pleasure to take this opportunity and share about Human Biologicals Institute. Human Biologicals Institute, shaping global healthcare by spearheading the One Health initiative. Indian Immunological Limited was established by the National Dairy Development Board (NDDB) in 1982 as its unit, and later registered as a company in 1999 with the name Indian Immunologicals Limited. Human Biological Institute was established in the year 1998 when the Government of India requested Indian Immunologicals Limited to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biological Institute was established at Ooty. This facility is one of its kind in India to have rolled out first virocell culture rabies vaccine in 2000. Subsequently, Human Biological Institute launched other vaccines and currently we are the major player in human vaccines. We are the leaders in anti-rabies vaccine segment and present in around 60 countries. We are three state-of-the-art manufacturing facilities at Ooty, Gachibowli and Karkapatla, also known as Genome Valley. Human Biological Institute has forayed into the market of clinically proven wellness products and infertility ranges of hormones. As a company, coming to our vision, mission, and values, our vision is shaping global healthcare by spearheading the One Health initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. Our values, we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' needs. As a company, as we know, we are the kind of company who will definitely look after taking care of environment as well. We proudly bring before you the Green Initiative. As we have launched our flagship brand anti-rabies vaccine Abhayaram, and with this we have taken a significant step to reduce the plastic burden by 160 ton per annum. As a company, we don't just manufacture and market products, but Human Biological Institute has done a lot in corporate social responsibility and has taken up various projects. One such project is adoption of government school. So IL has adopted two government schools in the vicinity of its Karkapatla facility in Hyderabad. Another program is Gift Milk Program in coordination with National Dairy Development Board. We are giving additional nutritional supplement to over 1600 school-going children of Telangana and Tamil Nadu. We have also facilitated the setup of an oxygen generation plant at Telangana Institute of Medical Sciences, Gachibowli. The unique advantage of this oxygen plant is that it is capable of supplying oxygen to 70 patients at a time. You can visit us on our website www.indiaimmune.com. You can contact us on our toll-free number 1800-313-999977. You can follow us on LinkedIn, YouTube, Facebook, Instagram, and Twitter. Also, you can go through a unique initiative on www.fearlessagainstrabies.com and everything you want to know about women health on www.pubertytomenopause.com. So once again, I welcome all our viewers who have joined us live today. In today's show, we are going to talk about a very important topic, menstruational health and hygiene. Well, 28th May is recognized as Menstruational Health and Hygiene Day. It is a day dedicated to raising awareness about the menstruational health and hygiene worldwide. The day aims to break the stigma surrounding menstruation, promote education about menstruational hygiene management, and advocate for improved access to menstruational products and facilities. So, to understand and know more, for this, we have a very special guest with us today. Please welcome Dr. Ashe Sahai. Dr. Ashe Sahai is a highly skilled and compassionate obstetrician and gynecologist with years of experience and expertise in women's reproductive health. She has been dedicatedly providing exceptional healthcare services to her patients. Dr. Sahai's expertise and commitment to women's health have earned her a prominent position in the medical field. A very warm welcome, Dr. Sahai, on our We Talk Do You show.
Hello, good afternoon, everybody. Good afternoon to all my listeners and to the audience.
Well, thank you, ma'am. Well, ma'am, I would request you to please let our viewers know. We'll start with our discussion. That, ma'am, the first question is: what are the some misconception or myth about the menstruational health and hygiene that you often encounter among your patients?
When you practice gynecology and obstetrics, around 50% of your patients will be coming to you with problems related to menstrual health. Mostly, they are all the spectrum of ages, starting from young girls, 13, 14 years of age, who are just having their periods for first time, to people who are up to 50 years of age, who are at the menopausal age. So, uh, definitely, we have to field all their questions which are there related to their general health. Most of the time, it has to be explained to them that it is not a disease, it is a regular part of the health problems, not a problem. It is a regular feature in the women's life. And then they start at around 13 years of age, what we call menarche, and then it goes on to childbearing, and then later on to menopause. So, what most of the people they will come to you is that come to me is that okay, she has started having periods. My young daughter, she is not able to go to school. I have to put her at home for 4 5 days, and then she cannot eat this. She can not have a normal food, and these are most of the misconceptions which mothers will come to us. Then, when we come to the younger lot, then they have their different problems of excessive bleeding or irregular cycles. And then going to the other extreme, that is when we come to around 50 plus, then definitely they will have different heavy bleeding problems, pain problems, discharge problems related to the menstruation. Definitely, hygiene is a very important part of our menstrual cycle, and that has to be explained right from the beginning in the school going girls, that it is a normal part of your physiology, and you have to take care of your body like you do for your teeth, for your hair, for your skin, and the rest of your digestive system. Similarly, when the menstruation comes, you have to take care of so many things of hygiene about your diet and everything.
Thank you, ma'am, for answering this question. Ma'am, there's another question I want to ask you, ma'am. Can you explain to our audience about the importance of maintaining the proper menstruational hygiene? And, ma'am, and as you said about it's very important to maintain it. So, how does it impact a woman overall health?
See, first of all, we have to explain to the patient that when she starts having a bleeding per vagina, the clean cloth or clean sanitary napkins have to be used. They have to be very clean. What most of the people who are coming from backward area, they are who are not educated. They are still using cloth which doesn't absorb the blood properly, and it allows bacteria and other germs to grow in that cloth. And there will be you will be surprised to know that there are still people who are coming that they will say, okay, we use the cloth. If the bleeding is less, we wash it with Dettol, dry it, and again use it, which is so very surprising. Instead of, in spite of our advertising so much, giving them so much of education, that unless and until you use a good absorbent cloth which is not wet when it touches your skin, till that time you will keep on having fungal infections, itching in the private parts, different urinary infections, infection in the vagina, which may travel to your uterus and later on to tubes and even into the stomach if the things are very, very bad. So, the importance of menstrual hygiene is very, very important. It is as important as telling them that bleeding, more bleeding or less bleeding is not a issue. Similarly, keeping the good sanitary and hygiene is very, very important. Keeping good pads, keeping very clean, changing the undergarments frequently, using clean sanitary napkins, which are to be thrown once they are soaked, even partially soaked, then they have to be cleaned and changed every 3 to 4 hours. Not that if you are having little bit of bleeding, you take one pad and use it throughout the day,
Yes.
which starts giving smell and then starts giving itching in the private parts of the female.
Yes,
So
ma'am.
overall health of the lady affects is very much affected with when she is having her menstruation, and then she may have lower abdominal pain, sometimes fever because of the vaginal infection. It leads to concomitant urinary tract infection also, and then which leads to fever and chills and rigors.
Thank you, ma'am, in explaining this question in a very simpler manner. So, hello.
Yes.
Yeah, yeah, ma'am. Thank you for answering this question in a very simpler manner to the audience, ma'am. So, ma'am, I want to ask you, what would be some of the most common menstruational disorders or conditions that the women experience, and how they can be managed or treated?
See, starting from the menarche, when menarche is when a young girl starts having her menstruation initially. So nowadays it has become in a very young girls, like the girls will start having their vaginal bleeding as early as 6 to 7 years of age when they are just in class 1 or 2 and they don't understand what is happening to their body, and sometimes they are very, very frightened. So we have to ask the mothers especially to tell these girls that this thing can happen to you. You can have a menstrual bleeding even when you are in school. Get them mentally prepared and send them to the school with some vaginal pads so that if they go to the toilet, start having little bit of bleeding, how to use the vaginal pad. And then they are, if the mother is educated, most of the time we try to educate the mother herself, that you have to tell the daughter that if little bit of bleeding is normal, then you may have little more, you may have the bleeding with pain in abdomen. You may, sometimes it is there for 4 days, 5 days, sometimes in some girls it is more, that it goes up to 11 to 12 days, and it is nothing to be frightened of, and it will become cyclical. It will be there every month, and then slowly it will become regular, it will become part of your life. When we come to the childbearing age, definitely we have to be very careful that the lady gets her periods every month, at least 3 to 4 days, and they come in a cyclical way, that is between 28 days to 34, 35 days per month. And then and she it's not very painful. It should not be as painful that she is not able to go to her office or do her own household work. If that is a disruption in her own household work because of excessive bleeding or excessive pain, or the bleeding coming very frequently, then definitely the patient has to go and consult a doctor, that there is something beyond the normal cycle. And then, thirdly, are the ladies who are at the extreme end of their menstrual cycle, that is at the menopause, when they may not have periods for 2 months, 3 months. Suddenly, it will become very scanty. It will be there only for 1 day or 2 day, and then it will go slowly. But here, there are ladies who are having bleeding for as long as 10 days, 15 days. And then the blood is so much that they have to use 5 to 10 pads a day. Then definitely this is a thing to be concerned about and going and consulting a doctor, because this is not a normal menopausal pattern. And any person who is having excessive bleeding or excessive pain or the bleeding is coming very shortly, that is every 15th day, the lady is bleeding per vaginum, then definitely she has to consult her doctor to see whether she is having any fibroids, any cyst, any infection in the uterine, ovary, or vaginal areas. So these are the different sorts of presentations which we see in our practice with the females. And definitely the management is according to the symptoms which the patient come to us. If the bleeding is too much, we have to regulate the bleeding, make it little less so that the female doesn't become anemic, doesn't become very weak, and she's able to go about with her normal work. So any sort of excessive bleeding at any given time, whether it is young girl, it is a female between 20 to 40 years of age, or a female who is near menopause, that is 45 and above, any excessive bleeding or any cycle which is coming very frequently, like between 10 to 15 days or 20 days, also short cycles, what we call, needs to be treated, managed properly by diet, by good uh, the treatment and hormones.
Uh, uh, yeah, yes, ma'am. So thank you so much, doctor, for bringing about telling the audience about the common menstruational disorders and the conditions that the women experience in the different age groups, and how it has to be managed and treated. So thank you, doctor, for answering this. Well, doctor, thank you once again for giving us a lot of information on the topic of menstruational health and hygiene. Doctor, it is time we take some questions from the audience.
Okay.
Doctor, we have received some internal questions. One person is asking, are there any lifestyle habits or activities that can help regulate irregular periods?
Yes, definitely. Lifestyle, in the lifestyle, we have to tell the patient that there are patients who are nowadays young girls who are suffering from polycystic ovarian disease, who
Yes.
are very obese, and sometimes they will have very scanty menses, and they will be having weight gain. They will be having facial hair, and because that is because of most of the children also, young girls and the young techni persons who are always sitting in front of their computers. They are not having any healthy lifestyle. They are not moving around here and there. So they gain weight. And for them, if the weight gain is more, then we will have this cyclic irregularities. They will have thyroid irregularities also. And for them, walking around, doing regular yoga, having more of greens, and reducing the weight is very, very necessary to regulate their cycle.
Thank you so much, doctor. Um, Doctor, there's another question asking, how can I determine my menstruational cycle is within the normal range in terms of duration and flow?
See, it is very, very different for all the females. For some, the flow will be for 3 days, 4 days, and it will be coming exactly on the same date in the next month. That is what we call from a regular cycle of 30 days and a bleeding of 3 to 4 days. But for another person who is having a bleeding for only 2 days and it is coming at 24 days, then also it is because it is there for her since she was a small girl, and it is persisting in the same way up to she has become 25, 26, 27. So for her it is normal. And for another person who bleeds for 6 days and her cycle comes at 35 days, but it is there regularly up to her end of the menstrual phase. So for her that is normal. So it is not written anywhere in the book that every person should have us bleeding for 4 days and it should come exactly on 30 days only. But as long as she's keeping good health, there is no pain, she's able to go around with her normal activity, and her hemoglobin is all right. And if she is married, she is conceived, there is no other problem in her sexual life, then it is normal for her.
Uh, Thank you, doctor. Thank you for answering this question. There's one more question asking what are the most effective ways to manage menstruational cramps and pain?
Most of the time, we tell the patients that a little bit of menstrual cramp will be there, which will be starting as soon as she starts having spotting, and then it increases on the first day. And once the flow sets in, it will decrease from the second day onwards. Once the bleeding starts and it sets in, so that is a normal menstrual cramp. But the girls sometimes they have too much. They will be having vomiting and nausea, and sometimes loose motions also. Very few of the patients are there who will be coming every month with severe pain in abdomen, and they will be requiring tablets and sometimes even injections. So, most of the time, we tell the patients if they have their regular activity and they just have healthy food, move around, have their exercise, drink a lot of water, then it can be taken care of. Most of the patients, if they take a hot water bottle and sit for some time, 1 or 2 hours, and just lie down and relax, then it will become all right. But if there is more pain, then we start with very simple paracetamol or NSAIDs, and after sometimes we go in for antispasmodic tablets like Meftal Spas and other things, and that the patient can take on the day one and day two of the cycle. And then once the pain subsides, then the normal cycle will continue for 3 4 days, and the pain will go once the bleeding stops.
Oh, thank you, doctor. There's another question asking, doctor, are there any specific dietary recommendations or restrictions that can impact menstruational health positively?
I don't think so. And no, it is, see, most of the time I keep on telling the patient it is your regular activity. It is like you keep on doing your regular activity. If you are an office going person, go to office. If you are a school going child, then you have to go to school. If you have a menstruation, that doesn't mean that you have to just take rest and stay at home. Taking lot of water, taking milk, green vegetables, and taking frequent or normal fruits and all, frequent diet, like every 2 hours 3 hours you take some fruits, take a lot of fluid, and if you are feeling some pain in the abdomen, you can have hot water or ginger tea, things like that, and which will take care of your bloating. And that is okay, fine, but no specific dietary things are required for that.
Um, Thank you, doctor. There's another question in the audience asking, what are the best practices for maintaining menstruational hygiene, including choosing the right sanitary pads and ensuring proper disposal?
Definitely, this is something which we come across so in so many of our patients, and most of them they see so many advertisements over the on the TV and everything. But I will explain that most of the time the sanitary napkins which is being used has to be absorbed, and the surface which is touching your skin, it should be dry, sort of whether it makes a gel inside or whatever, but the surface which is touching the skin should be dry. If the patient uses cloth, anything, even if with a cloth, if you see, if you use a damp cloth, if to even the wipe the table, it becomes damp and it remains damp unless you dry it outside in the sun, which you cannot do with your sanitary cloth which you are using. So don't use any cloth or any cotton or anything which remains wet once it comes in the contact with your menstrual blood and remains wet in contact with your skin for longer time. And if anything wet is there in your contact with your skin, it is going to give bad smell, it is going to cause irritation, it is going to cause itching. So there are different sorts of good sanitary napkins anyone you can use. Then there are tampons. If the patient who is having little less menstrual flow, they can use tampons also. Then nowadays menstrual cup is there, which has to be used, and once the patient feels that there is heaviness and the cup is becoming full, she has to remove it, wash it, and reinsert after hygienically cleaning it. So the basic concept is to keep the vaginal and the vulval part dry, so that there is no bad smell, there is no itching, and there is no infection going inside. And the other thing which I want to insist is, even if the patients, when she's at the fourth or fifth day of her menstruation cycle, most of the time they will use one pad, that it does not become wet, and the same pad will be used till the end, which is not good. The Because instead of sometimes the blood, there is some white discharge also, which is foul smelling, coming after the menstruation. So that also affects the skin at the vulva, and the pad needs to be frequently changed, mostly by 4 to 5 hours of use.
Uh, Thank you, doctor, for answering this question. Doctor, there's one more question. The person is asking, how can I manage and cope up with the emotional and psychological effect of menstruational related mood swings or hormone fluctuations?
Uh, can I know the age of the person who's asking?
Ma'am, she's in her 20s.
What is she doing? Is she studying or she's working?
Ma'am, she's currently working.
Okay, so the mood swings are very in are there in people who take it as it is something which is very different from my normal cycle. If you take it in your stride that this is going to come every month, and if little bit of pain is there, then I have to overtake it. I have to take some paracetamol or painkiller. Then I have to take good nice bath, clean myself, go from the office, take a nice hot bath, take some hot tea, coffee, and just relax. So, mood swings are there in people who are very stressed about their type of life, or if they take the menstruation as something which is very weird, which is coming to uh, just challenge their normal lifestyle. So, don't take it like that. If it is there, okay. If it is more, you take some painkiller. If the more bleeding is there, take frequent changes of pads with you. You can just go around, you can take your exercise, you can go to the gym. It is not necessary that you stop your normal activity. So if you will stop your normal activity, then definitely the mood swings and are going to be more. And just take it as a normal activity. And if the little bit of pain and things are there, just take painkillers and go about your normal life. So it doesn't need to be treated like a disease.
Thank you so much, ma'am. Thank you so much, doctor. It was a very wonderful session. Thank you for answering all the audience questions. Doctor, we wholeheartedly thank you, doctor, on behalf of my team as well as the Human Biological Institute for sparing your most valuable time with us.
Dipali, can I add something in the
Yes,
end?
sure, ma'am.
Doesn't Yes, because that most of the time people, girls who are coming from the families who have this system that if you have a menstrual cycle, you will not be allowed to go into the kitchen, you will not be allowed to touch food, you will not be allowed to go and pray, and not be allowed to go into the gym and things like that. And but mostly, if you will see in the Western country, they are using tampons and still going for swimming also when they are having the menstrual cycle. So if you have this sort of bias in your mind, then you are much more affected, and then you have more all these mood swings and things that, oh, something this 4 5 days I have to just stop everything and just be in my cocoon. So please get rid of all these thoughts from your mind, and then you will be much more happy.
Thank you. Uh, yes, thank you, doctor, for debunking this myth. Actually, there are a lot of myth regarding this menstruation, and thank you for giving an answer for this and giving a fact about the menstruation which is required. So, once again, thank you, doctor.
Thank you, Dibali, and thank you all the viewers who have been there. I hope I have been able to answer their questions properly, and they have been satisfied with the answers.
Yes, ma'am.
Thank you.
Thank you,
Thank you.
doctor. Thank you. And I know a lot of people who are watching us are benefited from this wonderful session. I wholeheartedly thank our viewers as well for being with us in each and every session. We request you all to visit www.puberty2menopause.com for more information on various health aspects of women at different stages of life. And you can follow us on LinkedIn, Facebook, Twitter to get more updates on health and life talk with expert doctor across the nation. With that, I wish everyone a very good evening. A very good evening, doctor, to you.
Good evening and good evening to all the viewers. Thank you.
Thank you